Good morning, everybody. Thanks for tuning in. David Johnson here, and I have the pleasure of Mr. Paul Levick with us today. Before we start, I'll just make sure Paul's happy that we're having this little chat today. And
it's good to talk about everything up until this point and the progress that all the NeuroHAB patients make.
Very happy to share your journey with our community of patients and members who often have a very long history of back pain. And Paul, let's go right back to the beginning then, shall we, of your journey. Tell us how did we come to meet? Right? It's a long time ago now, so I can't actually remember. 2018
I started in NeuroHAB, and I'll call it my first NeuroHAB because I went through the program twice, the 8-week program.
2018, so two years ago.
Yep.
And what made you come along to talk to me?
Well, to be honest, it's a little bit by chance, and it's amazing how these things unfold to be sort of very important things that happen. I'm a 42-year-old male now. Haven't had back pain since sort of early 20s, so around figures I always say I've had back pain for 20 years.
20 years.
Yeah, and like most people, you just push through in the early years.
Yeah. So 20 years is why do you think you started getting back pain 20 years ago? Or what was sort of
to be honest, I had no answers.
Understanding of it?
Yeah, I had no understanding and I had no answers.
Yep.
Every specialist who I visited along the way pointed to things like minor vehicle accidents. I had one when I was sort of in my teens. Injuries from playing sport, although there was no injury at the time. It may have developed over time. They're very much pie in the sky answers, and so I had no resolution.
Because lots of people at the age of 20 are going to be playing sports, and a few of us are going to have car accidents from time to time. Like they weren't major, near-death experiences in the car. Just things that happen to people that shouldn't really explain why you are afflicted with severe debilitating pain. Would you have said it was quite? How did it impact on your life at the age of 20 to 30?
Highs and lows. You have your good days where everything's normal as you remember it, and then you have your flare-ups due to whatever reason, high work volume, whatever the reason may be, and they were very restrictive. Reduced travel in a vehicle, reduced lifting ability at work. But again, as a younger sort of age bracket back then, you come out of that and life comes to normal, but what I now realise was a lower level of normal, and the degradation in what I could do.
So did you just manage it, so to speak, by modifying your lifestyle?
No, to be honest, I probably managed it by using the traditional modalities, physiotherapy, chiropractor, massage.
So you still wanted to. Did you still try to play sport? Did you still try to? You still were able to hold down a job? So I guess you don't treat it as a problem because most of your life is still tracking along as normal. You've got to, you've got to pay the bills, and you've got to support your family and things like that. But as part of your life, you were always having to go around and get these treatments, so to speak.
Sometimes you'd have standing appointments where you'd be there twice a week, continuously, every week.
Twice a week? It's like a huge burden, isn't it? Like
financial, time, psychological, everything.
And just think about, like nowadays, if I have to go and see the dentist, or if I've got to go have a haircut, or if I've got to, have an appointment with the optometrist, it's like, oh no, I've got this
thing on this
day. And this was you once or twice a week for years after years. Right. Okay. And when you had these appointments with the rehab industry, were they explaining to you why you were in pain?
Look, I genuinely believe every single one of them
doing their best
attempted their best with the tools they had at the time and the knowledge they had at the time. And the explanations varied, as I said to you, from previous blunt force injury to Yeah, everything I explained earlier, none of them alluded to maybe I was actually functionally poor in my movement patterns. Yeah.
So they really had a very structure-focused paradigm. Where something's wrong with your joint or your disc or your tendons or your muscles.
Absolutely.
Structure.
Yeah.
Okay. Going along with the interventions, did you need medications to try to control pain?
In the later years, I'll say once I was in my late 30s, some GPs started trying various anti-inflammatories. I couldn't say I had any success at all with them. To the point where a couple of them I just basically took myself off them.
Yeah, and I mean, when you take anti-inflammatories, that probably further consolidates in your mind that there's something inflamed, and therefore it reinforces there's something broken down here or something's not right. So you went on like that for what, another 10 years before you sort of got directed towards.
I'd say I just tracked along the highs and lows of it all for another decade. And then my wife and I were starting a family, and I thought, well, I need to get to the bottom of this problem. I've got children to support now. So I sought some advice from a spinal surgeon in Brisbane, and I sort of had my first appointment with him.
That wasn't myself.
It wasn't, no, it was Dr. Johnson.
Yep.
And basically he told me that I was too young to undergo any sort of spinal surgery, but he was sure he would see me in 5 years' time.
Right.
And that really put me on the back foot at that stage.
Yep. So further reinforcing that there's some part of your spine that's not healthy, and that even though it's a little bit early now to do something to that part of the spine, we can't remember whether it was L4-5 or L5-S1 or
L4-5, I think from memory.
Yeah, and it's sort of, the point is that it's further making you believe that L4-5 is on its way out, or it's just you're just too young at the moment to need a structural intervention.
Yeah,
okay.
and also made me feel like that was the only
solution.
Solution path forward. Yeah.
Wow, that's pretty interesting. So after you saw that fellow, you said, okay, well, I'll just keep going with the previous interventions that you've been doing. And what did they mainly consist of?
Dry needling, to be honest.
Dry needling.
I could say I've had more dry needles in me than I care to remember.
Yeah. So what does that feel like? Well, tell us, when you go to the dry needler, who happens to be who?
Generally I found to be physiotherapist,
right.
but I've also even had podiatrists use dry needles. Yeah, try and address some of the tightness I had lower down.
What's the process of dry needling, just for people who haven't really heard of it?
Yeah, I mean, it's literally just putting a sharp needle into a trigger point within the muscle to release the spasm within the muscle.
So you're lying down?
Lying down.
Any anaesthetic on your back or hot packs? Or
No. I think it comes down to the skill of the person administering it as to how painful it is or isn't.
Yeah.
And I've had some very good ones that they were never...
where it didn't hurt very much?
No.
Okay, so you had some dry needling.
Spinal manipulation.
Yes.
Which is...
What's that feel like?
It probably is more of a... it's not painful, it's just a fair amount of anxiety to know that someone's about to put a large amount of force through your already vulnerable spine.
Yep.
So yeah, they were never enjoyable treatments. And then massage as well. And again, they were all best intentions.
Sure.
But the day after...
That's what they do. They're a manual therapist, so they're going to give you manual therapy.
Yep.
You went to them, and that's what their craft is, so they're going to give you that.
Yep. But the long-term, lasting therapeutic value of it was, a day, 2 days tops, and you're back to where you were, basically.
Yeah. Okay. So you had nothing else to do, because the surgeon had said, well, one day come back and see me in 2 or 3 years, and so you just sort of shrugged your shoulders and I'll just keep doing what I did.
Excuse me. Things got to the point in 2017 where it was starting to affect my work, affect my ability to help out domestically at home. ability to travel, ability to short drives to the Gold Coast, that sort of thing.
That's pretty
Yeah, so it starts to become very impactful.
massive impact. Just going to the Gold Coast from Brisbane for a drive, just enjoy the day out.
So I started seeking out sort of that next tier of specialty help in terms of musculoskeletal doctors. And I think I saw 3 of them located around Brisbane.
Yeah.
And that's sort of when I started getting injections into the muscles in my back. And over the 2017, 2018 period, I had about 30 of them in my back.
30 injections. So these are deeper injections.
Yes. Yep.
Like targeting tendons, ligaments,
anesthetic based mostly. So releasing spasm.
Was that referred to as prolotherapy by any
I
chance?
had 6 prolotherapy injections in my SIJ.
Yep.
One of the physicians diagnosed me with an SIJ problem.
Yep.
History now tells me that it was pretty far from the mark.
Yep. Yep.
They were very unenjoyable. But all the rest were all muscles.
And at any point, did you sort of think, well, why are these structures inflamed? Like, why do they need these injections to sort of calm them down?
Do you know what? I probably didn't process it that deeply because I'd never received any information from any of these physicians. Tangible information that I could actually go with.
Looking back now that it's 2020 and you've obviously recovered extremely well, or I like to say the word cured. When you think back to all those injections that you had, what do you think now that no one told you? They were happy to inject you, but they didn't ever explain to you why they were injecting you.
It's money wasted, profound. It's time wasted, it's a lot of emotion wasted. I don't hold anger towards any of them. I just hold frustration.
It's not anger directed towards any one specific person, but it's in terms of the industry-wide approach.
Yes,
because there's lots of Paul Levicks floating around out there that right now are going through the same process.
Yep.
And
well, there's half a dozen of them behind us right now.
Exactly. So actually, on a side note, we are at Functional Movement Training Centre, and in the background you can probably see a NeuroHAB class going on, and Paul's going to talk to us about NeuroHAB in a second. But there's lots of people out there that have not discovered NeuroHAB or movement therapy.
Absolutely. Yeah.
And as a specialist, that's my mission in life, is to try to set in place a paradigm shift in the way people like you are looked after, because it's clear that this should be the very first thing that you got back 20 years ago. And imagine that 20 years of heartache.
Different story.
But okay. So why did you end up in my office?
Was that what I now know to be the last sort of musculoskeletal doctor that I was hoping could help me? He advised me that a epidural delivering cortisone directly onto my spinal structure would do the trick. So I went through with that. Fairly expensive exercise.
So that's an epidural injection?
Yes. Yep.
So that's, just for the listeners, that's designed to try to napalm all of the pain sensitive structures in your spine and try to just fire extinguish pain receptors.
Had that. It is so ineffective. The physician offered to do it again a second time at his own expense.
It didn't work once, so let's just do it again.
Yep. It was not an enjoyable day out, and B, if it didn't work the first time, what do I do a third, fourth, and fifth attempt until it works? So I declined, and he kind of said, well, I'm starting to run out of ideas, and he handed me a brochure for the Functional Movement Training Centre. I had no other options.
That's the first time, 2018, that you get given something that says movement.
Correct, yeah.
Functional movement. It's the very first time after 20 years of back pain, and seeing lots of people numerous times per month or week it takes you 18 years to get a piece of paper that says anything about movement.
Yes.
Wow.
Yeah.
Okay, that's why we need a paradigm shift. Okay, so you look at this piece of paper and you think, oh God, here's something else.
No. At that stage, I wasn't.
You said, sign me up. Give me something else.
Do you know what? It was probably more, okay, well, I have another step, because I was starting to really question what my next step would be. So, okay, whatever this may be, I don't know, but it is my next step.
Yes.
Jumped on the website, read as much as I could, and looked at as many videos as I could on the FMTC website. And the one thing that kept popping up is movement proficiency.
Yes.
And you know, what the hell is movement proficiency? We all move the same, right?
Yes. Oh, God. That's like saying when I go out on the highway, we all drive the same.
Yeah. Okay.
We kind of do, but we kind of don't as well.
Yeah.
There's lots of people out there that are changing lanes and doing crazy things. Yeah. Okay.
So I arrived to my first session, and immediately when I saw the trainers, the way they lifted up a weight, the way they moved, the way they as I say, the way they moved throughout the whole 1 hour session, I could immediately see, okay, I move poorly, and this is what proficient movement looks like. And then embarked on the 8 weeks. And to be perfectly honest, by the end of the 8 weeks, I was still in an equivalent amount of pain. But
it's okay to say that.
Yeah.
It's okay to say that. But what did you also know though?
I also knew that there was something that actually had some logic applied to it as to why I was in pain compared to the next person in the street who's not in pain. Yeah.
It's the beginning of your journey.
Correct.
It's the beginning of your journey to recovery. You're just at the very beginning.
Absolutely.
So of course pain's not going to just disappear in 8 weeks, but you, as you have persevered with those principles of treating it properly, and you'll get to the end of that journey. What did you think after day one? Did you know, when you saw the movement therapist moving well, did you think, wow, how come I haven't even done anything like this?
Yeah, a fair bit of frustration. Why am I 40? Well, I was 40 at that stage, learning this now. Why didn't I pick that up when I was 25? And I'd been in a very different situation at that point.
I was going to say that. Did you lie down on a couch at Functional Movement Training Centre?
Never.
Did you get any dry needle?
Never.
Did you get anyone rubbing your back?
Happy to be done with it all.
Never. Right, never. Because it's not possible to learn how to move when you're lying horizontal. It's not possible to learn how to move when someone's putting needles in your back or adjusting your back. Can you remember the very first lesson? What happened in the first lesson?
Yeah, the water bottle on the box.
Yeah. Just asked you to pick something up.
Asked to bend over, unscrew a lid on a Mount Franklin water bottle, and they film us doing it. And I'll be honest, I knelt down on the floor to unscrew it. And 8 weeks later, we repeat the task. And to a person, everyone improved. Yeah,
exactly right. So I think. The most important thing that people learn from lesson one is that there is a definition of good movement. You know, it's like these are the rules. Okay, these are the rules, and we're going to teach you how to play the game. Because if you don't have rules of good movement, I can't teach you. And that's the first thing that's unique about NeuroHAB, isn't it? Is hip-centric rotation, neutral spine, and 20 years that no one's given you those rules. So it's not possible for you to learn how to move well if you don't know what the rules are.
And that information's not on the internet. Like every back pain person, I've gone down the rabbit hole of hours and hours Googling. And now that I know these points of performance, I've never come across them anywhere on Google.
Okay, so you finish the program, and like your pain levels may still not have come down that much. Okay, why? And you said that you realised that this was different, and that this is a journey. What did you then continue to do?
It was Christmas by this stage. I had a fairly uncomfortable Christmas. Kept hip hinging throughout. Practicing
the good movement.
50 hip hinges a day. You know, they were the staple for many months. And
probably actually more, Paul, because if you think about all the other movements, like brushing your teeth and getting out of chairs.
And that's probably the most important thing from that first 8 weeks is there's no point being proficient during class and then going home and bending through your spine. So it was a lot of discipline. Every single movement had to be within the points of performance.
Yeah.
Getting in and out of chairs, in and out of the car as best you could, picking up the TV remote, always hip hinging.
Hundreds, if not thousands, of bending movements per day.
Yep.
Because we are bipedal creatures. We decided to stand on 2 feet, so therefore anything in front of us that's not at perfect height requires a bend.
Deflection.
And then you were informed that you've got a hip joint that should rotate.
Yeah, the whole concept of hip-centric rotation versus spine-centric, I mean, that was the first I've ever been exposed to that.
Lumbar-centric versus hip-centric. And lumbar-centric rotation creates that concentric loading or cyclic loading, which then creates the inflammation, which is the previous video that we put on the page. And so you just have to keep practicing.
Yeah, so that was my Christmas. Was we went away for a week, but I still maintained sort of discipline of movement. And I had, again, nowhere else to go, so I re-enrolled for another 8-week NeuroHAB program. And because I already had probably 2 to 3 months of hip hinging under my belt by that time, the second program I got a lot out of. I, pain levels were still quite high, but I was able to move as the program would like me to move.
You were just that little bit further along the track. And what did you think about the other patients? Could you see with the? Could you see that they were in the same position that you were?
Day one, you could see yourself 2 months ago moving poorly.
There were like mirror images of you. Before, that's pretty profound.
And I think the most important point to make is the quality of the coaches. They're absolutely amazing. Patience, positive attitude, and their skill level is just amazing.
Very much appreciate that. And I think they're super passionate about what they do, and also knowing that you've got this amazing weapon against back pain, which is a globally epidemic problem, and you've got this genie in a bottle. It's going to make you passionate. It's going to make you so passionate because here is this cure that you just want to give to everybody, right? Whereas if you've got something that's, this is pretty mediocre, I don't know whether this is going to work. It's not going to drive passion. It's not going to drive enthusiasm. Whereas if you look at our patients and I've got this amazing, I just want to give this to you. I want you to get better. I know you can get better.
I think I like that with my friends. That's probably push the information onto them a little bit too.
And it flows on into the patients because you're passionate. You become passionate about it as well, don't you? So you finish the next cycle of NeuroHAB. It's another 8 weeks. Moving further down the journey. Where am I going to go? I can see this is starting to work. Pain levels are still there, but I'm able to start helping, ridiculous things, pick up a load of washing, unpack the dishwasher, all those kinds of things we take for granted. So trainers informed me Neuro Move, which was around in those days, was the next step. 45 minutes of cardio, all under the same watchful eye of the same coaches who know my history. So rolled into Neuro Move, and that was a lot of fun. That's some really good people. It's fun, it's capacity building, and it's still applying the same rules of the game, the same rules of the movement that you learned on day one of NeuroHAB.
And the thing that sticks out, and this is all about what what resolution you look at your improvement on. I remember my first Neuro Move class, George, one of the coaches then,
hi George,
got me doing a deadlift, and I'm not joking, it was 13 kilograms, and I was anxious. I said, George, how the hell am I going to do this?
13 kilograms.
8 kilo bar, 2.5 on the jet. George, a week ago I was struggling with an 8 kilo dumbbell to do a deadlift, and now you get me to do 13. And she just went through everything.
You were super anxious about that.
It
created a lot of anxiety. Whereas 13 kilos is probably like 2 grocery bags at Woolies, right?
Ridiculous.
A couple of litres of milk, and a few bits of
but she just imposed on me, Paul, keep your shins vertical, push your hips back, engage your lats, posterior chain engagement.
And you're just spinning off these rules. To the listeners, those things that you just spun off, they're the rules, right? Paul's reciting them, but he also knows how to put that into mechanical practice. Okay, and you lifted it?
Lifted it, did a, who knows, set of 3, set of 5, don't know. No flare up. That's the ultimate fear of every back pain sufferer is the flare up. Of course, no flare up, no problem. And that goes back to the principle of gradual exposure. if you get out of that, there's no problem. Well, you go up a weight, you go up a weight, you go up a weight.
Yes. And psychologically, your brain's going, oh, I can do this. I am not incapacitated.
I'm not 2 weeks now lying in bed. So fast forward to June this year, so what's that? That's going to be about 14, 15 months. I can now deadlift more than my body weight. So that's.
Did you say now this year?
Yeah, this year.
Okay, yeah. So we jumped forward a couple of years now, or
14 months. So that shows you that gradual exposure, implementing correct principles. No injection is going to increase your capacity exponentially.
No. So we just basically kept staying under the supervision, the watchful eye of the coaches, and then eventually
this centre opened.
We opened Functional Movement Training Centre at Wollongabba, which is where we are now. And the natural inclination was for you to come over. Was that another level of anxiety that?
No anxiety. I had my biggest gains in terms of pain levels through NeuroMove. They went from a 10 out of 10 down to a 4 out of 10, whatever. So confidence grew. I wasn't lifting heavy weights. I was still very small weights I was lifting. My cardiovascular fitness improved, my functional capacity improved, and I realised for me personally to get rid of the stigma of me being a back pain person, I had to train with people who weren't back pain people. So I started chatting to the coaches. How do I come across to CrossFit Neuro?
Fantastic.
And coaches looked after me. Sam pushed me. Lockie gave me a couple of little sessions on some movements. And
just continually refining and making you better at applying those rules of the game. You're becoming better at the game of life. Better at the game of life, which is a physical game of life. Cool.
So 6 months in NeuroMove. I want to say September, October-ish, 2019. I come over here and just start CrossFit normal.
The athlete program.
I still scale some things, but I try and scale because of lack of skill rather than protecting any back pain movement.
So naturally, we don't all drive around at 250 kilometres an hour on the highway because we don't have the skill to drive at that. Plus, we're breaking the rules. So it's natural, and everyone who's engaging in functional training is scaling to some degree. So Paul and I have just done a functional training session today, and there were snatches, and there were box jumps, and there were dumbbell snatches, and my goodness, everyone scales that to the level of their capacity, but we're all moving biomechanically the same, which is what is driving that health back into our system.
And again, one huge point is it's the same coaches here. So they all have known me since 2009, 2018. They all know my background. And that's huge. Having that knowledge.
And I can say, Paul, as a clinician, I can remember you in the hospital. I can remember us standing, near the drinking fountain there. We were doing some deadlifts and back squats, and you were asking me some questions about range of motion. And I think I remember putting a box behind you as a depth gauge because I wanted you to keep moving well, but I wanted you to keep doing the movement. So we modify the range. You were moving really well, and I said, I know that it's still hurting, but you're getting close to the destination that you want to get to, and it's profound. Like when we were training today, Paul was next to me, you were next to me, and we were both just dying in this workout in a good way. But do you know how incredibly satisfying that is for me as your doctor? To be able to do that with you.
Great.
And the background journey, like you just people like you just complete my career as a clinician. It's just, I don't think anyone else can have that satisfaction that I get every day when I come and train with you guys. It's not the same as just doing an operation on someone and the operation going really well, because that's just purely me engaging in a structural repair to someone, whereas seeing you travel along this journey without the need for any invasive spinal surgery or dangerous and expensive type of intervention.
No intervention.
It's so profound, so profound.
How many months? Years, yeah.
So I think what I wanted to do is just to thank you very much, Paul, for trusting in us, and trusting in the team that you've so kindly, put the wind under. Because
they'll make me pay for that next session.
Yeah, exactly right. Yeah, but it's really it's so nice to hear that story, and you probably know a few of the other people in the gym who have come through that same journey.
Dave, by no means am I anywhere near as advanced as some of the guys who've come through NeuroHAB, maybe NeuroMove, and now train here. Some guys absolutely killing it.
So it's not like you're like an outsider. This just works for everyone because it's so fundamentally essential for the human musculoskeletal system to move well, and the end result is patient to athlete
and
transformation.
95% paid free.
We're still on the journey in a way.
Yeah, correct.
Still on the journey. But just we don't know where the goalpost of the end of the journey is. I don't think there is a real goalpost, because what you'll
stop trying if you get to that goal, won't you?
Building. You're just becoming more and more and more of an athlete every time you come.
That's how I treat it. That couple of years stint was half time in my life, and now my next 40, 50 years are going to be strong, fit, pain free. So.
Fantastic. All right, Paul.
Thank you.
Nothing else to add to that?
No, that's all.
I think it's a super chat. Thank you so much for sharing that with our community. I think that'll be a really popular video to listen to. A lot of learning points there. And see you at the next workout.
Tomorrow.
Tomorrow.
Cheers.
All right, mate. Thanks, Paul. I love it.